Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Hey there, Dr. Moya, how are you?
I'm great, Brittany. Looking forward to this podcast series today.
All right, well, today I'd like to talk to you about the Corset Body Lift. Why don't you tell us why you came up with that?
All right, well, I came up with the procedure approximately 15 years ago this upcoming June. I did so because I found that traditional procedures for weight loss patients, such as a tummy tuck, extended tummy tuck, or even a 360-degree tummy tuck, left many of my patients shapeless, meaning they didn't have a nice silhouette. So I was searching for an alternative to those procedures, and I knew that the fleur-de-lis tummy tuck, which has been done for many decades, was another option, and that procedure utilizes both an up and down incision as well as a standard single incision on the lower tummy as a tummy tuck does. I found that cinching the waistline provided a much better shape for many of my patients. So I expanded on that procedure because it was still limited in the area below the breast folds, mostly for women, because it still left patients with loose skin in that area. Mm-hmm. So I decided to add another incision to the fleur-de-lis, basically an incision that mimics a reverse tummy tuck. It's an incision that's below the breast folds and can be extended onto the upper back. And when I put all it together, I came up with a procedure that I call a Corset Body Lift. So in essence, that procedure provided the best shape that I could give my patients after they lost a lot of weight. And the reason that works so well is it actually is 3 tummy tucks in one. You're basically cinching the waistline in is the first one. Then you're going to tuck the lower waistline, which is more of a standard tummy tuck, and then you're going to lift the upper waistline, which is what you would do in a reverse tummy tuck. So when you combine all that together, you end up with a beautiful hourglass shape as a single procedure.
Wow, that's quite the procedure. It sounds like a lot of skin is being removed.
It is. It usually averages about 10 pounds for
Wow.
most of my patients over the years.
As compared to a tummy tuck, how much?
A tummy tuck on average, if you're looking at a weight loss patient who's lost, let's say, 100 pounds or more, you might be looking at anywhere from 2 to 5 pounds.
So a significant difference and a better result with a Corset Body Lift.
Absolutely. My belief is the more skin you can remove in patients that have lost a lot of weight, the better the shape is. The issue with these patients is they have loose skin in different directions. So you need to address that in the directions of where the problem of the skin is. So that's what the corset does.
And how long did you say you've been doing that?
I've been doing it for 15 years coming up in June.
Wow.
So it's I didn't start yesterday.
Right.
And we've treated patients with up and down incisions probably over 1,000 plus at this point in time.
That's amazing. So I'm assuming that it has evolved over the years.
Yes. So from where I started, today I have 3 different versions. So the idea is I do believe that for every patient, you have to customize the procedure. So no tummy tuck or no corset body lift is the same for each patient. So I found that there are certain body types that actually require a different approach to the corset. The end result is always an hourglass figure. What may change is the order of the steps and maybe where the incisions will end up at the end of the procedure. But the shape is what we're looking for here. That is number one priority. My patients who decide to undergo a corset body lift, they're not focused on scars. They're focused on the best shape possible because they're not walking around naked. They're walking around in nice clothing, and they want to have form-fitting clothing, and they want to feel good when they're standing as well as sitting or bending over.
Right. I'd rather have a couple of scars rather than have all that extra skin hanging around and having to tuck it into clothing. That would be a little bit more of a better result for me, I think.
I agree. I mean, it's, to each patient, they make the decision on what they want. Certainly, there are patients who may not want an up and down scar, and that's okay. We have the traditional procedures. The key is to set the expectation for each patient so they know what they're getting into and they know what the end result is. And the more options you have, meaning traditional procedures plus procedures such as the Corset Body Lift, the more patients we can help. And to me, that's most important.
Right. So it sounds a little scary with all those incisions. What is the recovery like? How do people feel afterwards?
That's a great question. The good thing is it's skin only, meaning it's not like my general surgery days where we're going into the cavity like the abdomen. It is a skin only procedure. So what that means is, you'll feel some skin pain for several days. If we do tighten muscles like you would in the tummy tuck, that's gonna hurt more. We treat them as we would a tummy tuck. The incision under the breast folds, I have to actually anchor that because it's the upper waistline lifting, so you want to anchor that lift in the right position. That hurts a little bit. It may hurt for 2 or 3 weeks. We do manage the patient post-operatively with some good pain control. I like to use some extended release narcotics as well as short-acting narcotics, and if we can get a NSAID on board, i.e. an Advil, Motrin, it's generic, it's ibuprofen. That helps a lot in combination. I also use a different technology. I use ultrasound for the removal of skin. In my hands, I found that it decreases pain significantly because there's less inflammation, and that's kind of built into the procedure when I do any of my body contouring. But for a corset, it's very important, and one of the reasons why we can even get away without drains.
I was just going to ask you about the drain situation.
So there's no drains in any of the procedures. For a corset, a procedure of that magnitude, that makes the recovery, since we're talking about recovery, even easier. Basically, it simplifies the recovery. You don't have to deal with managing drains, keeping them clean, stripping them so they don't get clogged, recording the drainage as it's coming out, having to deal with any of that. And for me, that's a significant step in the right direction for the patient experience after surgery. So we're always looking for ways to make not only the procedure better, but the recovery better. So something that we're always working on. So one of the things we've been doing is drainless surgery, and that's going on, I guess, 12 years this year, is drainless surgery.
Yeah, a lot of patients do not like drains. And what about time off of work? How long do you think somebody would be home recovering?
So basically, no matter what the procedure is, if you're going to say take a Corset Body Lift, since it's a big procedure, it still mimics the time out of work like a tummy tuck. Usually we tell patients it's 6 weeks, no heavy lifting, no strenuous activities, no exercise. Usually I like to have patients off work for at least 3 weeks. So for me, a tummy tuck would be 2. Here we do an extra week. We do 3 weeks off work for the best comfort for the patient before they return. And then as long as they have limited activities at work, then they can go back.
Mm-hmm. Okay. Well, thank you, Dr. Moya. Thanks for hanging out today.
Well, thank you. Looking forward to the next one.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corset Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.